The importance of self-care. Informational packets and forms will be at the following website. Is self-care important? Yes. Self-care is important for maintaining overall well-being and promoting a healthy lifestyle. Self-care refers to taking deliberate actions to prioritize and nurture your physical, mental, and emotional health. It involves recognizing your own needs and taking steps to meet them in a positive and proactive way. Physical health. Engaging in self care activities such as regular exercise, eating a balanced diet, getting enough sleep, and practicing good hygiene can help improve and maintain physical health. Mental and emotional well being. Self care activities like meditation, relaxation techniques, engaging in hobbies, spending time with loved ones, and seeking support when needed can help reduce stress, manage emotions, and enhance mental well being. Preventing burnout. Regular self care helps prevent burnout by allowing you to recharge and replenish your energy levels. It helps reduce feelings of overwhelm and exhaustion that can arise from excessive work or responsibilities. Enhancing productivity. When you prioritize self care, you are better equipped to handle daily challenges and responsibilities. Taking care of yourself can improve focus, concentration, and overall productivity. Boosting self esteem. Engaging in self care activities that make you feel good about yourself can help boost self esteem and self confidence. It reinforces the idea that you value yourself and your well being. Maintaining healthy relationships. Self care allows you to nurture your own needs, which in turn enables you to better support and care for others. By taking care of yourself, you can show up in your relationships with more energy, patience, and compassion. Remember, self care is a personal practice and it looks different for everyone. It involves listening to your own needs, setting boundaries, and making time for activities that bring you joy, relaxation, and rejuvenation. Does self care help with medical conditions? Self care can play a role in managing certain medical conditions. While the clinical evidence specifically focuses on the long term health benefits of self care is still developing, research suggests that individuals with chronic conditions who engage in self care activities are more likely to have better mental and physical functioning. Self care interventions can include practices, habits, and lifestyle choices that promote and maintain health, prevent disease, and help individuals cope with illness. For example, individuals with chronic illnesses can engage in self care behaviors such as medication adherence, symptom monitoring, and lifestyle modifications to manage their condition. Chronic illness management. Self care behaviors such as adhering to medication regimens, monitoring symptoms, and making lifestyle changes can help individuals manage chronic conditions like diabetes, heart disease, or high blood pressure. Stress reduction. Engaging in self care activities that reduce chronic stress can help lower the risk of developing health conditions such as heart disease, high blood pressure, and gastrointestinal disorders. Improved quality of life. Self-care practices that address physical, emotional, and mental well-being can contribute to an improved quality of life for individuals with chronic medical conditions. It's important to note that self-care should complement medical treatment and be tailored to individual needs. It's also recommended to consult with healthcare professionals for personalized guidance and support in managing specific medical conditions. What types of self care are good to practice? There are various types of self care that can be beneficial to practice. Physical self care. This involves taking care of your physical well being. It includes activities such as eating a balanced diet, getting regular exercise, getting enough sleep, practicing good hygiene, and attending to any medical needs. Healthy eating. Fueling your body with a balanced diet that includes nutritious foods is an important aspect of physical self care. Eating a variety of fruits, vegetables, whole grains, lean proteins, and healthy fats can provide the necessary nutrients for optimal health. Regular exercise. Engaging in regular physical activity is crucial for physical well being. Exercise can help improve cardiovascular health, strengthen muscles and bones, boost energy, and increase overall energy levels. Finding activities you enjoy, such as walking, jogging, dancing, or participating in sports, can make exercise more enjoyable and sustainable. Adequate sleep. Getting enough quality sleep is essential for physical health and overall well being. Establishing a consistent sleep routine, creating a comfortable sleep environment, and practicing relaxation techniques can help improve sleep quality. Hygiene and self care practices. Taking care of your personal hygiene, such as bathing, brushing your teeth, and practicing good skincare, is an important part of physical self care. It promotes cleanliness, prevents illness, and contributes to overall well being. Medical care and checkups. Attending healthcare appointments, seeking medical advice when needed, and following prescribed treatments or medications are essential aspects of physical self care. Regular checkups and preventative screenings can help detect and manage potential health issues. Remember, physical self care is not about striving for protection or adhering to strict rules. It's about making conscious decisions that support your physical well being and finding a balance that works for you. Mental and cognitive self care. This type of self care focuses on nurturing your mental and cognitive well being. It can involve engaging in activities that stimulate your mind, such as reading, learning new skills, solving puzzles, or practicing mindfulness and meditation to promote mental clarity and reduce stress. Mental set management. Mental self care involves managing your mindset and thoughts. It includes practices such as positive affirmations, gratitude exercises, reframing negative thoughts, and cultivating a growth mindset. These activities can help improve your overall mental well being and resilience. Stress reduction. Engaging in activities that reduce stress and promote relaxation is an important aspect of mental self care. This can include practices like mindfulness meditation, deep breathing exercises, progressive muscle relaxation, or engaging in hobbies and activities that bring you joy and relaxation. Learning and mental stimulation. Cognitive self care involves activities that stimulate your brain and promote mental growth. This can include reading books, solving puzzles, learning a new skill or language, listening to educational podcasts, or engaging in creative activities that challenge your thinking. Emotional regulation. Taking care of your emotions is an essential part of mental self care. This can include practices such as journaling, expressing emotions through art or writing, seeking support from loved ones or a therapist, and practicing self compassion and self care during challenging times. Setting boundaries. Establishing healthy boundaries is crucial for your mental well being. This can involve saying no to activities or commitments that drain your energy, setting limits on work or social media usage, and prioritizing time for rest and relaxation. Seeking support. Mental self care also includes seeking support when needed. This can involve reaching out to trusted friends or family members, seeking professional help from a therapist or counselor, or joining support groups to connect with others who may be experiencing similar challenges. Mental and cognitive self care practices may vary for each individual. It's important to explore different activities and find what works best for you in promoting your mental health well being and cognitive functioning. Emotional self care. Emotional self care involves nurturing and tending to your inner feelings and emotions. It is about taking intentional action to support your emotional well being and promote a positive mindset. Emotional awareness. Emotional self care starts with developing an awareness of your emotions. It involves recognizing and acknowledging your feelings without judgment. This awareness allows you to better understand yourself and your emotional needs. Emotional expression. Finding healthy ways to express your emotions is an important part of emotional self care. This can include journaling, talking to a trusted friend or therapist, engaging in creative outlets like art or music, or participating in activities that allow you to process and release emotions. Stress management. Practicing stress management techniques is crucial for your emotional well being. This can involve relaxation exercises, deep breathing, mindfulness meditation, or engaging in activities that help you unwind and reduce stress levels. Boundaries and self compassion. Setting boundaries is an essential aspect of emotional self care. It involves recognizing your limits, saying no when necessary, and prioritizing your own needs. Additionally, practicing self compassion and treating yourself with kindness and understanding is important for nurturing your emotional well being. Seeking support. Emotional self care can also involve seeking support from others. This can include reaching out to friends, family, or a therapist for guidance and understanding. Having a support system can provide validation, perspective, and a safe space to express your emotions. Emotional self care is a personal journey and it may involve different practices for different individuals. It's important to explore and find what works best for you in nurturing your emotional well being. Social self. Social self care involves nurturing and maintaining healthy relationships and connection with others. It focuses on fostering a sense of belonging, support, and community. Building and maintaining relationships. Social self care involves investing time and effort in building and nurturing relationships with family, friends, colleagues, and other individuals who are important to you. It includes engaging in activities that support connection, such as spending quality time together, having meaningful conversations, and participating in shared interests or hobbies. Setting boundaries. Establishing healthy boundaries in relationships is crucial for social self care. It involves recognizing and communicating your needs, saying no when necessary, and ensuring that your relationships are balanced and mutually beneficial. Seeking support. Social self care includes reaching out for support when needed. It involves seeking help, advice, or guidance from trusted individuals in your social network. Having a support system can provide emotional support, different perspectives, and a sense of belonging. Engaging in meaningful social activities. Participating in social activities that bring you joy and fulfillment is an important aspect of social self care. This can include attending social events, joining clubs or organizations, volunteering in your community, or engaging in activities that align with your interests and values. Practicing active listening and empathy. Social self care involves being present and attentive in your interactions with others. It includes practicing active listening, showing empathy, and being supportive and understanding towards the needs and experiences of others. Remember, social self care is about finding a balance that works for you and prioritizing relationships and connections that contribute positively to your well being. It's important to engage in social activities that align with your values and bring you joy, while also respecting your own boundaries and needs. Spiritual self care. Spiritual self care involves nurturing your inner being and connecting with something greater than yourself. It is not necessarily religious, although it can be for some individuals. Connecting with your higher self. Spiritual self care involves practices that deepen your connection with your higher self, which is your true essential beyond ego and fear. It is about aligning with your deepest desires and operating from a soul centered place. Exploring meaning and purpose. Engaging in activities that help you explore and find meaning in life is an important aspect of spiritual self care. This can include reflection, journaling, meditation, or engaging in practices that align with your personal beliefs and values. Engaging in rituals and practices. Spiritual self care can involve participating in rituals and practices that hold personal significance for you. This can include meditation, prayer, attending religious services or ceremonies, reading spiritual texts, or engaging in activities that promote a sense of connection and transcendence. Spending time in nature. Connecting with nature is a powerful way to nurture your spiritual well being. Spending time outdoors, appreciating the beauty of the natural world, and engaging in activities like hiking, gardening, or simply being present in nature can be spiritually uplifting. Seeking inspiration and wisdom. Engaging with inspirational resources such as books, podcasts, or talks can be a form of spiritual self care. These resources can provide guidance, promote introspection, and offer insights that support your spiritual growth. Spiritual self care is a deeply personal practice that can vary for each individual. It is about finding what reverberates with you and supports your spiritual well being, though it is through religious practices, personal beliefs, or a connection to something greater than yourself. Practical self care. Practical self care involves engaging in activities and practices that directly contribute to your overall well being and daily functioning. It functions on taking care of your basic needs and ensuring that you are equipped to navigate the demands of everyday life. Physical health. Taking care of your physical health is an essential part of practical self care. This involves activities such as maintaining a balanced diet, getting regular exercise, staying hydrated, getting enough sleep, and attending any medical needs for checkups. Personal hygiene. Practicing good personal hygiene is an important aspect of practical self care. This involves activities such as bathing or showering regularly, brushing your teeth, and taking care of your grooming needs. Organization and time management. Being organized and managing your time effectively can reduce stress and increase productivity. This can involve creating to do lists, setting priorities, breaking tasks into manageable steps, and maintaining a well structured schedule. Financial management. Taking care of your financial well being is crucial for practical self care. This includes activities such as budgeting, tracking expenses, paying bills on time, and saving for the future. Be mindful of your financial situation can help reduce stress and promote a sense of security. Comfortable environment. Creating a clean and comfortable living space can contribute to your overall well being. This can involve activities such as tidying up, decluttering, and creating a space that promotes relaxation and tranquility. Setting realistic boundaries. Setting boundaries in various aspects of your life is important for practical self care. This includes setting limits on your time, energy, and commitments to avoid burnout and ensure that you have the capacity to take care of yourself. Practical self care is about attending to your basic needs and creating a foundation that supports your overall well being. It is important to find a balance that works for you and prioritize activities that contribute to your daily functioning and overall quality of life. How to create a self care routine. Creating a self care routine is a personal process that involves identifying activities and procedures that support your well being and incorporating them into your daily life. Reflect on your needs. Take some time to reflect on your physical, emotional, and mental needs. Consider what activities or practices make you feel rejuvenated, relaxed, and fulfilled. This could include activities like reading, exercising, meditation, spending time in nature, or engaging in hobbies that bring you joy. Identify realistic activities. Consider the activities that align with your needs and are feasible to incorporate into your daily routine. Start by choosing a few activities that you genuinely enjoy and that can be easily included into your schedule. Start small. Begin by incorporating one or two self care activities into your routine. Starting small allows you to establish a habit without overwhelming yourself. As you become more comfortable, you can gradually add more activities into your routine. Set a schedule. Determine when and how often you will engage in your chosen self care activities. It could be a specific time of day, a certain number of times per week, or whenever you feel the need for self care. Setting a schedule helps create consistency and ensures that you prioritize self care in your daily life. Be flexible. Recognize that life can be unpredictable and your self care routine may need to be adjusted from time to time. Be flexible and willing to adapt your routine to accommodate changes in your schedule or circumstances. Practice self compassion. Remember that self care is not about perfection or adding more stress to your life. Be kind to yourself and allow room for imperfection. If you miss a day or don't follow your routine exactly as planned, it's okay. Self care is a journey, and it's important to approach it with a mindset of self compassion. Remember, creating a self care routine is about prioritizing your well being and finding activities that work for you. It's a process of trial and error, so be open to exploring different practices and adjusting your routine as needed. How often should one practice self care? The frequency of practicing self care can vary from each individual and dependent on personal needs and circumstances. There is no one size fits all answer to how often one should practice self care. Consistency. Consistency is key when it comes to self care. It's important to incorporate self care activities into your routine regularly rather than sporadically. Consistent practice allows you to reap the benefits and make self care a habit. Daily self care. Engaging in small self care activities on a daily basis can be beneficial. These can be simple practices such as taking a few minutes for deep breathing, practicing gratitude, or engaging in a hobby you enjoy. Daily self care helps to maintain a sense of well being and can be integrated into your daily routine. Weekly self care. Setting aside dedicated time for self care on a weekly basis can be helpful. This can involve engaging in activities that require more time and effort, such as taking a long bath, going for a nature walk, or indulging in a favorite activity. Weekly self care routines can provide a deeper sense of relaxation and rejuvenation. Flexibility. It's important to be flexible in your self care routine. Some weeks may be busier than others, and you may need to adjust your frequency or duration of your self care activities accordingly. Listen to your needs and adapt your routine as necessary. Ultimately, the goal is to prioritize self care and make it a regular part of your life. Whether it's daily, weekly, or a combination of both, finding a frequency that works for you and allows you to consistently engage in self care activity is key. Self care is a personal journey, and it's important to listen to your own needs and preferences. Experiment with different frequencies and activities to find what works best for you. What activities can I do for self care? When it comes to self care activities, there are numerous options to choose from. The key is to find activities that renaissance with you and address your specific needs. Physical self care. Engaging in activities that promote physical well being, such as exercising, going for a walk or a run, practicing yoga or stretching, getting enough sleep, eating nutritious meals, staying hydrated, and taking care of your personal hygiene. Mental and emotional self care. Prioritizing activities that support your mental and emotional well being. This can include practicing mindfulness or meditation, journaling, reading a book, listening to music, engaging in creative outlets like painting or writing, seeking therapy or counseling, or engaging in activities that bring you joy and relaxation. Social self care. Foster connections with others by spending time with loved ones, reaching out to friends or family, joining social groups or clubs, volunteering in your community, or engaging in activities that promote social interaction and a sense of well being. Spiritual self care. Explore activities that nurture your spiritual well being, such as meditation, prayer, spending time in nature, practicing gratitude, engaging in religious or spiritual practices, or connecting with something greater than yourself. Intellectual self care. Stimulate your mind by engaging in activities that challenge and expand your intellect. This can be including reading books or articles, learning a new skill or hobby, solving puzzles or brain teasers, attending educational workshops or webinars, or engaging in thought provoking discussions. Sensory self care. Engage your senses in activities that bring you comfort and relaxation. This can include taking a warm bath or shower, lighting scented candles, listening to soothing music, practicing aromatherapy, cuddling with a pet, or enjoying a favorite food or beverage. Self care is a personal journey, and it's important to choose activities that renaissance with you and address your specific needs. Experiment with different activities and find a balance that works for you. Self care is an essential practice for maintaining your overall well being. Prioritize getting enough sleep each night. Aim for 7 to 9 hours of quality sleep to allow your body and mind to rest and rejuvenate. Drink an adequate amount of water throughout the day to stay properly hydrated. Dehydration can affect your energy levels and overall health. Mindfulness and meditation. Incorporate mindfulness or meditation practices into your routine. These practices can help reduce stress, increase self awareness, and improve overall mental well being. Consider keeping a journal to express your thoughts, emotions, and reflections. Journaling can be a therapeutic process that helps you gain clarity and process your feelings. Don't forget about digital detox. Take regular breaks from electronic devices and social media. Engage in activities that don't include screens, such as reading, spending time in nature, or pursuing hobbies. Self compassion. Practice being kind and compassionate towards yourself. Treat yourself with the same care and understanding that you would extend to a friend. Set boundaries. Learn to say no when needed and set healthy boundaries in your relationships and commitments. This helps prevent burnout and allows you to focus on what truly matters to you. Creative outlets. Engage in creative activities that bring you joy, such as painting, playing a musical instrument, or writing. These activities can be both enjoying and fulfilling. Physical touch. Incorporate physical touch into your self care routine. This can include hugging loved ones, getting a massage, or practicing self massage techniques. Seek support. Reach out to friends, family, or professionals when you need support or guidance. Seeking help is a sign of strength and can provide valuable insights and assistance. Remember, self care is unique to each individual. It's important to listen to your own needs and preferences and adapt self care practices accordingly. Regularly incorporating self care activities into your routine can help you manage stress, maintain balance, and enhance your overall well being. Now, let's go put self care in our routines. Informational packets and forms will be at the following website. Thank you so much for watching. I hope you enjoyed this video. If there is a video you would like to see, leave me a message in the comments. Don't forget, like, share, subscribe.